10 minutes to your health.
Welcome back, everyone. From the police to teeth. I don't know how we jumped to that one, but this one is very, very important, especially for people like Neville who are afraid of the dentist. Dental x-rays or radiographs are images of your teeth that are taken by the dentist and that he or she uses to evaluate your oral health. There are a number of x-rays that a dental professional can order, and the type of x-ray needed will depend greatly on the type of care that the patient needs to receive. Here to tell us more about this is dental surgeon Dr. Sharon Robinson. Good morning, Doc.
Morning, Doc.
Good morning, guys. Thanks for having me this morning.
How do you approach a gentleman like this who first and foremost doesn't even want to get in the chair?
He's special.
Thank you, I knew that.
The first thing he told me was that I'm having to be put to sleep, but the regular general dentist will not do that unless you're seen by a specialist, like an oral surgeon. But in my practice, it's about reducing your fare, and it starts with the front. We try to, the TLC helps, spending time to communicate with you and to reassure you that, and explain to you what we're doing. It's in your best interest not to deliver pain. I try to practice a pain-free dentistry.
Hear that? Can you manage now?
Every dentist.
You should try. No, you should try.
Says that.
Every dentist says that. By the way, let's go to the X-ray. If I come and I have a cavity, and obviously you could see the cavity, would I still need an X-ray just to ensure that there's nothing else going on, or no?
Of course, it's highly recommended because the X-ray helps us to detect the extent of the disease on that tooth. It is possible that even though you see it inside the mouth visually, that the disease is in close proximity to the nerve. So the treatment then may change to a root canal and then crown the tooth.
Why do you keep saying disease?
Because decay is a disease.
Oh, I didn't know that.
Cavities, it's the same, yes, it is a disease. It's a disease that affects the tooth. That's what a decay is.
Yeah.
So it's good that you mentioned that, because I believe that's why some persons will take it for granted. They don't see it as a disease that spreads to other areas of your mouth.
Yeah. Going back to the X-ray, so does that mean then that from I have a problem, I should get an X-ray argument done? So every time you go to the dentist, is it recommended that they do an X-ray?
It is recommended to do an X-ray.
Every time?
Every time. It allows the dentist to be better.
Just
it allows
in the area
you,
where you have the issue, or?
on a routine exam, it's recommended that we do a series of periapical X-rays and bite wings. You're a dental assistant and you've done some of those. So it allows us to also create a plan that allows us to see over time that you don't have something developing that we could prevent before it gets worse. So it's important to do it for that reason. So it's not about detecting in that moment what you're having, but it's more for prevention, to prevent it from getting worse. So it's in your best interest to do that.
A lot of people are concerned about the damage that X-rays will do to a person. Can you assuage their concerns in terms of that?
Absolutely. It's minimal. In this day and age, and even in my practice, the trend now is towards digital radiology. And it's the same in medicine. The amount of radiation that's exposed to the patient, it's 80 to 90% less than traditional X-rays. So it's a non-issue. There was a time, Neville, when I was a dental assistant.
Really?
Yes, I was. When we had to wear monitors just to expose a patient to X-ray. Now, it's not required in the practices anymore that we wear those monitors because the amount of radiation that even the dental office is exposed to is next to zero.
And the monitor would have done that?
Over time, it's given to an external lab that it helps to detect if within the practice we're exposed to the radiation because we're taking so many X-rays.
And
that was back then.
But did it actually happen that people were that exposed that it would have caused issues?
No, but these machines can be defective.
That's true.
Okay.
So.
Oh, what about children? Is it recommended that children get X-rays as well?
Yeah. And for children, we look to see, they go through these stages where they are developing they have baby teeth and they have adult teeth. So there are special X-rays like the occlusal X-rays that we will use to determine where their teeth are, if they're coming in properly. For orthodontic reasons, the children will need, they will need more of the panoramic X-rays. But yes, it's important that the children get it as well, so we see development. Of course, anyone, because I cannot do my best job without the imaging.
All the information.
And the imaging allows me to get a clear indication of what's happening with the teeth, because a lot of times you don't see the problem with your eyes.
I was just going to say, even if because you guys have a little mirror thing that you put in, you could see everywhere. So even if you could physically see it, you still think that the X-ray is necessary.
The enamel on the teeth, it's one of the hardest substances in the mouth. And it will take the X-ray to show me if there's a breakdown in that enamel or a dent within the tooth structure, or the root, we can't see the root, or the bone around the root. You know, it tells me that you're having gum issues, for example. It tells me that you have an abscess at the root of your mouth. It tells me...
That can't be picked up with the naked eye.
Correct. You have another lesion going on within your jaw. I need to send you to your doctor, your oral surgeon, you know? So it's very important that we do imaging for that reasons, because we're limited. It's just one diagnostic tool.
A lot of people are concerned about cost because a lot of Jamaicans don't have insurance. And I know that it is an added cost every time they have to do the X-rays. But is there any way to tell them how many X-rays you might need a year, so it's something that they can budget for? I mean, you're supposed to see the dentist twice a year, yes, with no problems. So would you suggest that every single time you go, that is something that you need to add to the cost of your dental appointment?
You know, because cost is an issue, if the patient is high risk, you see, it depends on what's needed. It depends on the individual. It can't be the same for everyone.
Who is high risk?
Patients.
I mean, who?
High risk meaning that you're at high risk for cavities. It could be that you are, as much as you brush hard, Neville, and you floss, you're just going to be developing cavities for different reasons. So you are high risk, as opposed to someone else who, year after year, they could just abuse their oral health. You know, they don't they do the minimum. They haven't seen me in 18 years, 0 cavities. You know, you hate those people, right? Yeah. So what happens is you have to be able to tailor it to the person's need. Now, what I would recommend, though, is they have to see it important, because they're limiting the dentist treatment of them if they're saying, no, I can't afford. What I will say, though, is in present age where we have digital X-rays, though it's a higher upfront cost for a practice to incorporate it in their practice, it's actually more cost-effective long-term for them to have that. And also, because the images are stored on a computer, it can be transported, whether it be email or to another office, so that reduces the cost for a patient taking multiple X-rays.
So this is a recommendation for the dentists and dental practices.
And at the end of the day, it decreases the cost for their dental health long-term, you know? Yep. So it's important.
Strange question, Dr. Shar. If I do what I'm supposed to do, I brush, I floss, why would I still have issues? Why would I be high risk if I do all these things that I'm supposed to do?
Very good question. For some patients, it could be that they are just prone to it. They inherited this from parents. You don't get to choose your parents, unfortunately. It could be that you're taking certain medications that put you at high risk. For example, I have patients in my care, and you know, it's painful, but you have to take them through it. You baby them through it. You know, whether they're on drugs like steroids or antidepressants that will suppress the production of saliva. I don't want to give you all the technical stuff, but there are reasons why someone would be high risk for decay and needs to be in the care of the dentist more frequently than every 6 months.
Okay. Where's your practice?
I'm located at Winchester Business Center, Shop 5. It's called Dental Place Cosmetic Spa.
All right.
Cosmetic spa, I like that.
Thank you for coming. You're a dental surgeon.
Thank you, Neville.
There you go. By the way, just before we close this off, remember we were talking to the married couple that goes to the
couples counseling.
Couples counseling. It is free. It is at the Solid Base Complex on Brunswick Avenue. That's in Spanish Town, and it's every first Monday. So it is free, and the solid base complex, and apparently you even get some goodies, some food and stuff, and it is free. So if you think you need help with your, well, I don't know if you need help, but
Or
if
just come right
yeah,
in.
you want to go, you could go. Thank you so much.
Thank you,
Great
Doc.
to see you.
Thank you, guys.
10
Thanks for
minutes
having
to
me.
your health. Sit with us for a
Doc,
while. 10 minutes
okay.
to your health. We'll do it again next Thursday.
All right, Smile does continue after the break. We're not finished yet, so don't go anywhere. Stick and stay.
I think I went with this doctor. Man.
No,
I
you're
call this
staying.
10 minutes to your health.